Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabitha Moretto. Our guest today is Dr. Philip Artemy, leading Australian dermatologist and director of the Vitiligo Centre Australia. To mark World Vitiligo Day, he is calling for greater awareness and understanding of the condition to help stem the growing trend of bullying and low self-esteem among sufferers. Without further ado, welcome to the show, Philip. It's so nice to have you here.
Thank you for having me, Tabitha. How are you?
Wonderful. Thank you so much for asking, and it's my pleasure for you to be on the show. So can you tell the audience more about yourself and your organization?
Well, I'm a specialist dermatologist. I am the founder and director of the Vitiligo Centre Australia in Western Sydney, and I'm also a visiting medical officer at the Skin Hospital in Westmead, Sydney, where I'm a Mohs surgeon. I'm the head of the Vitiligo Surgery Department, and I run a specialist vitiligo clinic there also.
That's fantastic to hear. So, doctor, how prevalent is vitiligo in Australia?
It's very common. The overall incidence is said to be 1 to 2%. So that would mean we'd have a minimum of about 250,000 Australians who suffer with vitiligo. But the incidence is probably higher because the condition is underreported. A lot of patients don't see a doctor because they don't think anything can be done. So some people think the incidence is over 5%, which is very significant.
I see. So as we know, vitiligo is a skin disease. So is there any treatment or cure for this?
Well, there's no cure for vitiligo at the moment, but there are a number of treatments. Now, the treatments, of course, have to be tailored to the patient. Is it a child? Is it an adult? Is it localized? Is it widespread? But there are a lot of treatments. The important thing about treatment is the earlier you get to the patient, the better the outcome in terms of putting the brakes on the overall process and in terms of helping repigment the skin, which has obviously lost its pigment.
I see. So how can patients manage their condition?
Well, I think with all these things, you start with your general practitioner. That's your first port of call. Your general practitioner may commence some treatment in mild, localized cases, but if there's some warning signs that this could be an unstable vitiligo, meaning it could spread, you really need to seek urgent referral. And some of those cases will include vitiligo, which is increasing by 5 to 10 lesions per month. We also speak of vitiligo, which has a lot of inflammation around it and itch that's unstable. We speak of particular types of vitiligo which have multiple colors. They're called trichrome. So you start with your GP and you seek urgent referral with your GP's help for treatment, which will be for the skin and for potentially the psychosocial impact of the condition.
That's good to know. Now, if you don't mind, Philip, can I ask you a personal question?
Please.
Why are you so passionate about helping people with vitiligo? Why are you so passionate about promoting this and raising awareness?
Well, my dermatology career has always been focused around surgical treatments associated with dermatology. And in 2015, I took an interest in a procedure called autologous melanocyte transplants, where we can try and harvest skin from the normal colored areas of the body, process that in the laboratory, and transplant that back into vitiligo. But interestingly, the more I started to do that, the more I started to talk to the patients about their vitiligo. And actually, I was really touched and upset by some of the things I heard or saw. For instance, children ostracized at school, children bullied at school, people who were engaged to be married who had their engagement broken off because of their skin, because of the genetic implications for offspring, parents who were fraught with fear of kids being stared at, etc. So I sort of got attached to the emotional side of the condition, which made me want to do more than just the surgical side.
Wow, that's amazing. Thank you so much for sharing that story with us. It's a good thing to know that somebody like you is really keen on promoting vitiligo awareness.
Look, I thank you for that. I think it's important we promote it so patients have a voice. Patients know that their GP is aware. Patients know that people are interested in researching the condition, because we really have to have better research to have better treatment. And we need to be aware that it's not just a skin condition. It's not just cosmetic, so we can help them with these psychosocial aspects of the condition.
Yes, I agree with you on that. And it's so unfortunate that a lot of people are being bullied, especially children, because of this condition.
Well, it's like society in general. We tend to not like people who are different. So my approach to vitiligo is you obviously treat these people like you would someone with a different sexual preference, someone with a different religion, someone with a different skin color. Everyone is equal. We're just a bit different.
I love that message. Everyone is equal. So before we go, Doctor, what is your main takeaway message to all of our listeners out there? What would you like to tell them, especially if there's anybody listening out there who has vitiligo?
Well, I think to people with vitiligo, you have a voice. If you're concerned, see your GP and ask to be referred to a specialist with an interest in vitiligo. And you need to understand the best treatment for you is a holistic approach. We need to look at things like your vitiligo. Yes, we need to look at your diet. There are some evidence that diet can help. We need to look at your psychosocial situation. But for GPs listening, you need to be educated, and we're happy to help. The Vitiligo Centre can provide brochures and posters and online information, and that way I think we all work together to get the best outcome for the vitiligo sufferer and for their family, who are often the forgotten victim in vitiligo.
Fantastic. And one more question. For those who want to get in touch with you, how can they do that?
Well, if you log on to vitiligocenteraustralia.com.au, that's a brand new website. There's an avenue there for general practitioners to refer, and there's an avenue there for us to take some inquiries from anyone with vitiligo, and you can call us on that number and speak to our staff.
Fantastic. Thank you so much, Philip, for coming on the show. It was wonderful having you.
Thank you, Tabitha. Lovely to speak to you also.
And that was Dr. Philip Artemy. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moretto, and you're listening to Health Professional Radio.